So now we're on to the leg, and more importantly, the femur. And this is just the upper part of the femur. So you have the head of the femur, but in the head of the femur is a very important structure right here. It's a little indentation. This indentation is called your fovea capitis. And the fovea capitis is where arteries, veins, and nerve come from the hip and bring the blood supply into this part of the femur. And you've probably learned in class that long bones form in 3 different sections: the head, which you can't see the other side, and then the shaft. When they form together, they tend to form a little line where blood supply and nerves can't go through. So if for some reason the nerve and the blood supply get severed in the fovea capitis, this tissue and the cartilage around it becomes necrotic, and this starts to grind into the acetabulum of the hip, and then that will lead to hip surgery. So that's why knowing the fovea capitis is very important, and knowing the head of the femur is very important. Now, a very frustrating structure here is right here. And this structure right here is called the greater trochanter. If you remember, in the humerus, it was called the tubercle. But because this structure is bigger, it has a different name. So in the femur, it's a greater trochanter, and flip it around, a lesser trochanter. In between the greater trochanter and the lesser trochanter is the intertrocharic crest, and in the anterior, or the front, or the anterior part, it just has an intertrochanteric line. Now, if you kind of look, the front and the back, front's going to be smooth if you're touching it. The back is going to have this ridge that runs down the back of it. The back of this ridge, or this ridge, is called linea aspera. So if you follow the linea aspera all the way down, you get to the bottom. So how do you tell medial lateral? Head's always going to be medial. Follow it down. Medial condyle, lateral condyle. An intercondylar fossa. And then on the front is where the patella is going to sit, and that's the patella surface. And if you kind of see this strange bone just kind of laying around in your bone box, that's the patella. And the patella sits right in the patellar surface. Right like that.